Rachel Plotkin-Alamase, Health and Wellness. Community members describe her as exceptional, a dynamo, and a fixture in Long Beach. Rachel Plotkin-Alamase, a former nurse, now does community work and teaches nursing at East Los Angeles College. She volunteers with Central Shalom and the American Cancer Society. She was also a graduate of Leadership Long Beach and is the health chair for the NAACP. One of the programs that is important to her is the Ambassador Program, where parish nurses and health ministries come together to promote healthy living and active care in the faith communities. Rachel is known to run health fairs where the community has access to flu shots, basic testing, referrals, and resources to people who might not have access to it otherwise. It takes Rachel working 6 or 7 days a week in order to accommodate the different organizations that she caters to, including schools, churches, synagogues, and temples. Community members highlight her work with minorities, specifically campaigning for bone marrow matches for people of color and addressing high blood pressure and nutrition. In addition, Rachel founded and chairs the Faith Health Ambassador training to teach religious representatives about preventative medicine. Linda Silas, Health and Wellness. Linda Silas firmly kneads her patients back and gently squeezes each finger as a part of her massage therapy she gives to the families she works with. As a board-certified chaplain with Providence Trinity Kids Care, Linda works with dying children and their families, providing both spiritual and physical comfort. Deanna Melzian, her spouse and nominator, says that Linda has an amazing heart for people of all walks of life. Working with dying children is the saddest thing in the world, but Linda does it with a big heart and gives a lot of comfort to people. Linda believes that working with dying children has been incredible because of all the wisdom they have. She says that they are in tune with their spiritual side, care about their families, and definitely know more than their parents think they know. When visiting families, Linda fosters communication, encouraging parents to be truthful with children about their condition and not shouldering the blame for their child's illness of which they had no control over. Linda goes into the situation and brings a special spark as well as comfort to these families. She softens the blow. Death is never easy, but she helps to make the way more gentle. Cindy Skovgaard, Health and Wellness. As Executive Director of Pathways Volunteer Hospice, Cindy Skovgaard's direct style of communication is just one part of her emphatic commitment to providing services for the community, whether it is caregiving, bereavement, or education. The mission of Pathways is for people to live well in accordance with what they feel is right, without the pressure of insurance and medical companies. Life shouldn't be so hard, Cindy says. It's tough enough, especially when illness gets involved. We just try to make it as fulfilling as possible. Life should be lived well, and that means different things to different people. Cindy refers to Pathways as the middleman. We know who is doing the best job in town, and we get to be opinionated because we don't take anyone's money. We're in it 100% for the families. Cindy assists families dealing with hospice and says it's about living to the best of your ability with dignity and quality of life. She helps organize the family and provides support where needed. Cheryl Carter nominated Cindy and says she was immediately impressed with her. Cheryl refers to her as a hard worker who is totally consumed with Pathways. She is a ball of energy and always puts her heart and soul into everything she does.